Well, moving on, and again, we'll hold the questions. Ferg and I are doing a dog and pony show on this moderation this afternoon, so it's my pleasure to introduce the next two speakers, and they are a tag team, literally. Both Craig and Scott are going to from one presentation into the other, so I'm going to introduce them both. Craig Andrews is professor and Charles A. Kelstad Chair in Marketing at Marquette University. His research focuses on advertising and public health issues. Dr. Andrews recently served at the Food and Drug Administration in Washington, D.C. as a social scientist at the Center for Tobacco Products and as a senior scholar at the Center for Food Safety and Applied Nutrition, and previously was a member of FDA's Risk Communication Advisory Committee. Scott is Distinguished Professor and Tyson Chair in Food and Consumer Products Retailing, Department of Marketing, Sam M. Walton College of Business, University of Arkansas. Dr. Burton's current research interests include consumer health and welfare, effective disclosure and warning information on consumer attitudes and choice, and public policy concerns. He currently serves as a special external consultant to the U.S. Food and Drug Administration Risk Communication Advisory Committee. So take it away.
Can I ask you to use this mic?
Is that not working?
It's hard to pick it up just because.
Okay.
Yeah, we learned. All right, great. And just
In our last Food Forum meeting, we had a fire drill. We're having some technical problems now. So what we're going to do, and this is for the webcast audience as well, is we're going to a break right now while we get the technical sort of details. Oh, after Jeff. Okay, so we're going to a break early. So you're up here, Craig. You better take it away before you break.
We're finished. Thank you very much, Sylvia. I don't have pictures of the Kardashians, sorry, or Gwyneth. I think there's a picture of a colleague pointing to organic cookies that I'm going to show you. What we're going to do is to talk about experimental research on consumers. And so that involves control groups, manipulated facts panels, claims, et cetera. And it's about 45 years of research. So I'm going to try to summarize that quickly. Show you a couple of models of persuasion that you might be interested in. A couple of people have mentioned these that we feel help summarize the field. A little bit about halo effects, generalizing issues, all sorts of baggage that consumers take with them. A little bit about some of our older research on nutrition claims and advertising. Then I'm going to hand it off to Scott, and he's going to talk about some recent front-of-pack research as well as caloric labeling. So warning, this is what consumers are confronted with in the stores. I'm thinking of when I lived in DC over here, the Whole Foods at 14th and P, it's chaos, lines all the way to the back of the store, the poor parents with kids in tow, and we're seeing all of this. And a lot of it isn't regulated by the FDA, but you've got reductive front of pack symbols like the traffic lights, you have facts up front. We've got IOM stars that are more evaluative. We've got organic, we've got GMO free. Oh, nutrition facts are on there someplace as well. So it's a very difficult environment. Okay, basically, there are different types of claims that are out there, and some of you know this. Nutrient content claims describe the actual nutrients. So for example, low fat, zero cholesterol, and so forth. Health claims will link that substance or nutrient to a particular disease. That's the magic element there. And there are 12, I believe, approved health claims with the FDA, a variety of qualified claims that we just saw with Carol in her presentation. And then as a result of the SHEA, there are structure-function claims that occur with functional foods, which describing the structure or function of the body. Things like helps the immune system or builds strong bones and so forth. There's also a variety of nutrition symbols across the world. Scott's going to talk more about these. Things like the facts up front here in the United States, traffic lights in the UK, IOM stars, smart choices was up there at one time, but we have a couple of articles that summarize some of these issues. Also, as some of you know, there are changes on the facts panels. So we're going to see some proposed changes there and hopefully some research on some of the switches on the daily values, making calories more prominent, added sugars, and those sorts of things. All right, do nutrition disclosures work? I think that's the bottom line. Well, the answer is it depends. And there's a lot of factors in play. Like the other speakers have said, it's fairly complex. Things such as the right objectives that you're measuring for the right audience. So is it exposure? Is it awareness? Is it behavior that you're focusing on? What's the audience involved? Are these the nutrition elite that we discovered in some of our research? Or those that have extremely low fluency or knowledge and so forth? So there are a lot of things out there. Anytime you see these experimental studies, what's the message content? What's the mode of communication, the source? And the one that we really enjoy is on the receiver effects. There's a lot of baggage that consumers take with them. Pre-testing is really important before you get into a lot of the studies. All right, this is a little bit, the elaboration likelihood model was mentioned a second ago. So this is an adaptation of that with nutrition claim persuasion. And again, people are in different environments, maybe different medical conditions, various ages, genders. They're also exposed to that dizzying array of information I just showed you. But the baggage, the initial opinions that maybe from Gwyneth, from Kardashians, from elsewhere, come to play, certainly in interacting with that information. But the key is the box there on motivation, ability, and opportunity to process the message. So for example, with the opportunities, a lot of distractions, time issues. People are under stress, so they eat more. And so there's a lot of factors that can come into play. If the motivation, ability, and opportunity are all high, then it's likely that pretty good outcome where they're scrutinizing the message, evaluating it, and that'll lead to positive or negative attitudes and behavior change. Although in our field, we study a lot of peripheral facts, those celebrities, those cues, organic, GMO, et cetera, that those that might be deficient on their opportunity, motivation, or ability might have, and it might lead to short-term effects, short-term processing, short-term decisions that are out there. All right, there's another way of looking at this too, steps in information processing. So again, this is important. Are you looking at just simply exposure, just attention, or is it something a little more important as far as actual comprehension of the nutrition information? Some argue just, hey, leave them to the right choice. So there's a lot of arguments there. Based on that review of about 45 years of nutrition and health claim research, you can line this up with McGuire's communication persuasion model. Most of the research that's been out there, experimental research, has been on message claims as well as receiver effects. Not as much on source effects, and especially destination. We talked about immediacy. You know, some target groups are just focusing on the here and now. And so I think much more could be done on the destination issues. All right, some classic articles out of our field, especially on warnings, have talked about why things fail. Well, maybe people aren't attending to them. It's not personally relevant. Familiarity is something that hasn't been talked about yet so far. So people may be motivated. They're already familiar with their brand. It's routinized purchase. Somebody told me earlier they just want to go in and out of the store. I mean, you hear that? So that sort of thing can be a problem as far as processing information. Desensitization after repeated effects. You know, geez, I know my brand. I'm not going to even look and analyze things. Also, I thought of my time at the Federal Trade Commission, too. There's a clear and conspicuous standard, and there's factors on communication. So one of these that's important is dual modality. So both audio and video or visual is very important. The audience, so children, different from older adults. And so I could go on quite a bit, but this is substantiated with years of research. All right, the biases, halos. Things happen. We found this in our research. So there's positivity biases. So just because a health claim or symbol's there, it's ranked as more positive. We found halo effects. So maybe you're dropping a zero cholesterol, a low cholesterol, and there's some attribution that suddenly the fat level is low as well. Magic bullet effects. Geez, I'm eating this Subway or, quote, healthy thing, so therefore that'll be a magic bullet against all the bad stuff that I'm going to eat later on. Interactive effects, where suddenly it's ambiguous, and maybe you're using prior knowledge or a health claim that will interact with that information. One of the studies that comes to mind, Brian Rowe, Alan Levy, and Brenda Derby did a number of years ago. They found truncation behavior. So the presence of a health claim on the front truncated search behavior for the fax panel on the back. Oh, there's my picture with a colleague. Brian Wansick is one of our colleagues. He's pointing to some organic cookies here. But most of you are familiar with some of the branding and size effects that he's done. I love this study on container size effects where people were eating more even though the popcorn was actually bad. It was horrible and they kept eating it just because they had more. Or the what we call, not the Prius effect as before, but the Subway effect. So same calorie food, people were estimating as 21% less calories just because it's Subway as opposed to McDonald's. All right, the keys are motivation, ability, and opportunity. I think the real value, though, for future research is on the last one. I think more needs to be done. You just look in the stores. They're under stress. There's limited opportunity, time, issues, distractions. So I think definitely more can be done in that area. All right, just quickly, share with some research out of the past that we were thinking about in advertising. We had a pretest where we lined up products from nutritious versus not nutritious as rated by consumers. And we selected two that were significantly in the tails, margarine and soup. We did a study in margarine. This was back in '98. We had a variety of claims on nutrient content claims. We found that these were overgeneralized to healthiness, and especially a halo effect to things like low in fat, saturated fat, things like that. Well, it took an evaluative disclosure, we called it the hammer, to reduce those sort of effects, that it was, as you can see up here, designated to be, it was high as evaluated by the FDA, and we also listed the per serving amount. We didn't think we would need that. But the important thing is this worked across nutrition knowledge levels, we think, because of the perception of the product was not as nutritious. Flip side, soup, exact opposite. It required higher nutrition levels because they thought, soup is good for you even though the sodium levels are still high. So it required higher nutrition levels for that very disclosure. Okay, thank you. I'm going to hand it off to Scott. He's got the harder part than me. So Scott's going to tell you a little bit about front of package symbols and caloric labeling in restaurants. Thank you.
Okay, like Craig's been talking about, we see that there's a provision of accurate nutrition information often doesn't lead to these unambiguous effects that we'd like to see. So we know there's all types of individual difference variables that we can see, many contextual influences that come with where people are seeing this information, thinking about overall the health halos and health horns that we might see, environmental effects, et cetera, that can all affect choices. So I'm going to look at some of these differences for effects of front of package disclosures and calorie labeling in restaurant chains. These are two topics Craig and I have been interested in over the last few years. So a basic front of package research question we see being stated is, what's the most effective way to communicate this front of package information? And so we classify these into a couple of different areas. We think of one format as being primarily reductive, and this is something that's also be considered objective. This is a GDA format. We take information from the nutrition facts panel, we condense that information and put it on the front of the package. We simply reduce it. We can compare this type of format with an interpretive or evaluative type of format in which we take the information and we qualify it in some way to indicate the relative healthfulness of the product. So this would include things like the IOM stars format. Walmart's great for you. So some of these we can think of as dichotomous. Some of them are more tiered in terms of their evaluation. Generally speaking, we can think that for products that vary in their objective product nutrition level, that adding this information, moving it to the front of package really has some benefits. And so there may be some hierarchical benefits, but at the same time, we're interested in something that marketers think about as comparative versus non-comparative tasks that consumers have. So conceptually, the effectiveness of front of package icons, we think, depends on the processing task that consumers are really engaged in. So are they comparing the healthfulness of products where you have different brands within a category, or are they evaluating a single brand? So both of these different types of comparative and non-comparative tasks really are relevant to the NLEA goal to provide information that would assist consumers in maintaining healthy dietary practices. But nevertheless, the nature of the processing for the consumer is very different for these tasks. And we will say that for these comparative tasks, where I'm trying to evaluate many brands, NFPs just aren't very practical. I don't have enough arms and hands to really be able to do this very effectively in a grocery store. So one of the things we did as researchers, we just kind of went with basic questions where we were asking about icon attributes, just asking consumers in terms of 7-point scales that we have, what are your perceptions of these different types of front of package icons that are available in the marketplace? And so the objective icon is considered to be quite specific, detailed, is quantitative in its orientation, and when you ask consumers, they say this icon is more appropriate for single product evaluations. Conversely, we can see that some type of tiered evaluative or dichotomous icon is perceived by consumers to be interpretive in its nature. They think about these things as being also for the kind of ease of comparisons are easier for them when you think of these evaluative component that they have. And it's kind of similar to this. They also see that these are going to be more appropriate for product comparisons. So given these kind of basic pilot study data, we think of models like this where we're thinking about the type of cue that we see on the front of the package in terms of its overall effectiveness is going to be moderated or differ as we think about the nature of the processing context that people are actually going through. So based on some type of theory, we can just think that an evaluative icon should be a better match for consumers in a comparative processing context than in a reductive. An reductive icon should be really a better match in a non-comparative processing context. So one of the things we do is we run these little experiments. People are in different groups. They see different type of icons across different types of processing tasks. So in a comparative processing task, we had consumers look at 5 different meal products and examine them simultaneously, and then evaluate just the one product that was really objectively the most helpful. And in a non-comparative condition, they're only shown that single same healthy product and base their evaluations on the impression. So just to kind of show what this looks like, we have a little grocery store mini lab type layout. And so when we ask consumers to compare products, they see 5 different products. And for these 5 different products, we have shelf talkers in which they are shown either an evaluative icon or a reductive icon for each one of these 5 products. And in a non-comparative condition, they're looking at the single objectively helpful product. And again, some consumers see a reductive icon, other consumers see an evaluative icon. And so we have this little shelf setup where they can go in. Normally consumers will do 3 or 4 shopping tasks, so we can run separate little types of studies within here. And one of the studies would be this specific task where we're looking at these different front of package icons. So we look at a variety of different types of measures. So we think about, the ease of determining how healthy the product is in a consumer's mind, the overall healthfulness evaluations. And I'm going to focus on the last one, which is purchase intentions. Essentially, we get similar results across what we see here. So when people are using the evaluative cue, so in this case, this is something like the IOM stars, we can see that for this evaluative cue, purchase intentions of this objectively helpful product are higher than when they're seeing the non-comparative condition. Okay, so we see these effects reversed when they are using the reductive cue. So the reductive cue, they ended up with higher purchase intentions for the non-comparative task than they did for the evaluative task. So the nature of the task makes a difference in the performance of the cue. So when you take data like this, we also extend it to kind of a bigger comparative context study where we can look at just choice as a dependent variable. Choice is not a good dependent variable if you only have one product. So when we look at this, we're manipulating in this study situations in which they can see both types of icons on a package. They can see just the reductive, they can see just the evaluative, or they can have no front of package icon at all. And here we're looking at the objective product helpfulness across a set of 7 different products, where we can look at product choice as a key dependent variable. So we're kind of crowding a lot of information on these packages, probably pretty consistent with what you see in the marketplace today. But these are examples for 2 different categories where we would see 2 different types of front of package information. And again, they can see both types, either type of front of package information or none at all. And so again, product set, 7 different products within the category, some objectively helpful, some not helpful overall. And what we tend to see is that in this comparative overall situation, the evaluative icon times the objective product helpfulness interaction is significant. And so what this essentially says, when the objective nutrition level is high for the product, adding on the stars onto the front of the package increases overall purchase intentions for this objectively helpful product. Adding the evaluative icon helps. It's the opposite direction when we see the objective nutrition level being low. Adding the evaluative icon under the front of the package tends to reduce people's purchase intentions. These same sort of results extend to product choice, where we can see adding the evaluative icon encourage people to choose the more helpful product overall. So you see the direction of the result for the reductive icon is positive, it's in the correct direction, but it's not statistically significant. So essentially there's lots of interest by the FDA and many other groups, considering the potential effectiveness of different types of FOP formats. But this recent research really suggests you got to think about the specific processing context. What situation is the consumer in? Are they evaluating a single product, or are they really considering a set of products? So this is kind of this simple idea. As the processing difficulty increases for the consumer, the importance of having some type of evaluation or interpretation for the front of package information is going to benefit them. And so kind of a simple idea that we're kind of showing within this context. Generally, however, across a number of different studies we've done, there seems to be some value, some benefit of any type of front of package icon examined relative to just having the NFPs only. So I'm going to totally switch gears and talk about something I've been interested in along with Craig for about the last 10 to 15 years, and this is what would happen with calorie disclosures for restaurant chains. So as we know, since the NLEA was passed in about 1990, people have become more and more interested in increasing the overall amount of food they're eating away from home. And so this is a personal story of someone who's relatively low in their level of nutrition literacy. So when my kids were young, a number of years ago, before you could ever find any information about calorie or nutrient levels for foods you got in restaurant chains, I would go to this dinner house restaurant with my kids once every 2 or 3 weeks. And as a good Texan, I would order this platter of nachos off the appetizer section of the menu, and this was my meal. And so, I'd have my nice little bowl of jalapenos and everything, and I knew this wasn't a very healthy meal. I'd look at it, I'd see that cheese, I'd see the dollop of sour cream, it was on 10 to 12 chips, but at the same time, when they finally started disclosing this information online, I was a bit surprised in a negative way that I was eating a couple of days worth of total fat. Saturated fat concerned me more, where I saw 3 days of saturated fat. Sodium was about a day and a half. I was quite full when I walked out. And it did have some good things. Very high in protein, good amount of dietary fiber, but nevertheless, this was far beyond my expectations about exactly how unhealthy this meal was going to be. And so one of the things we saw in this environment was that around 2009, this was a map of states and localities interested in having disclosures of calories for restaurant chains. One of the things we were seeing occurring was all the different states and counties were interested in slightly different types of disclosures. And for an industry that really depends on standardization, this is not a good thing. So they were very concerned about this. And the National Restaurant Association all of a sudden became very interested in having a national law. And so in 2010, we saw the National Menu Labeling Law that was passed. They were very happy because this national law overrode the differences they saw in these different states and localities and kind of established a single set of ground rules that we're going to have to abide by. So now in December 2016, the FDA changed the date. We're going to see this in restaurant chains throughout the United States. So for those of us that do research, it's probably not too surprising that we see there's a segment of consumers who want to make some more helpful food choices when eating outside the home. There's a segment of consumers who care very little about calorie and nutrient content of restaurant foods, and generally that might be a larger segment. Many consumers anyway, will misestimate the calories for foods they consume away from home, like me and my nachos. The changes for the information environment offers the potential for the greatest impact for consumers who are motivated to make healthy food choices and are misestimating some items. So we see this big variance, these big differences potentially across different consumer segments. So one of the things we've seen is that, generally speaking, in these menu labeling studies that have done in labs, which I've done quite a few of these types of studies, we do see that providing calorie information affects what people say they will choose, but the nature of these effects do differ for specific segments, contexts, and conditions overall. So just a quick example of what you see. We have a bunch of items we would pull from dinner house restaurants. We knew what the objective calorie information was for the items. So one group of consumers sees the control menu with no calorie information. A second group of consumers sees the same items, the same menu format, but adds the calorie information. And we look at people's choices of what they'd order for a dinner. And when you run studies like this is pretty typical of what you would see, that you see that people that are provided with the calorie information choose a meal with about 250 fewer calories overall. However, when you start to look at we have this health value orientation scale. I have an item down here, but it shows that until people reach about a level of 5 on this 7-point scale, you don't see a significant difference in the number of calories they're going to order. So, this kind of contrasts a little bit with what we've seen from many of the studies that are done in marketplaces like New York, Seattle, Philadelphia, where we've had menu labeling exist for a few years. And so this isn't too surprising when you think about averages, when you think that calorie labeling is only going to have effects for some items where calories are misestimated. They're going to have effects for some people. These are health literate, motivated, knowledgeable consumers. And they're only going to have effects on some occasions and some situations. You also get into these questions of, are there some segments that would be out there that might try to maximize the number of calories for the amount of money they're spending? So you get into some real questions about the nature of the different segments that are out there. And so this is kind of when you go through all of the factors Craig and many of the previous speakers have talked about and think about this funnel, we can think that all of these factors weigh in so that we really anticipate that the consumer segment that's really going to be impacted in a favorable way here is probably relatively small for any single purchase that they might make. Because we know that there are many contextual factors that are going to play out, many individual difference variables that are all going to kind of weigh in together to impact what we might order at any one particular time. And so this is what happens when we start to think about mixing together some of these different food value orientations. We can see for different food value orientations, there's going to be a segment that's really high in this health value, simultaneously low in emotional value, where you see a tremendously big drop in the calories ordered. You can see as you start mixing in these different motivations, the effects tend to diminish. And in some instances, you might see this mix of motivations and really what people value, leading to increases potentially in the kind of calories they order when they have a disclosure like this. So the bottom line is that there's many motivations, value orientations that for foods outside the home that really differ substantially across consumers. You know, as we think about taste, we think about amount, we think about the quantity, they think about convenience. All of these things weigh in together, and we have to think about the combined effects of all these different motivations and situational contexts that are going to play out in thinking about effects. So low-calorie, health-related disclosures, you know, often can lead to these negative inferences that consumers make, inferences about taste, inferences about levels of satiation, inferences about the quantity that I'm going to consume, and many of these factors are really, really important for certain consumer segments. So because quantity, convenience, and taste are often going to trump nutrition and health information, you know, calorie disclosures for chains may lead to increases in calorie consumption, at least for some very specific segments. And so these effects on restaurant reformulations, I think, simultaneously really need to be considered. So if we think about the aggregate effect of calorie disclosures in chain restaurants, one of the things that's going to come into play is what the restaurants really do with this. So the nature of how they make changes in their menus, the formulations are important. So I showed this kind of nutrient profile for these nachos that I used to eat 15 years ago. I looked them up last week. They're still unhealthy, but they're not as unhealthy as they used to be. So there are some things we're going to see. And so I would like to give a shout out to Brian and Pierre who had this model. This is one of the things, again, from the situational standpoint, we're talking about choices that people make, but a lot of these things become so important in the context of the consumption quantity or amount. So when I'm at home Saturday night, sitting around with a bunch of friends watching the Texas Notre Dame football game, I might go to my fridge, I might make a healthy choice in terms of the snack foods I pull out, but during the game, if I sit there and eat 6 or 7 portions of that healthy snack that I have, that in terms of what it's going to do for the total consumption I have, is not going to be a very good choice. And so this idea of all these factors that affect consumption quantity, volume, and overall intake are hugely important. So we do know that consumers are exposed to this broad array of nutrition claims, icons, and information on a daily basis. This results in many types of inferences and sometimes questionable conclusions that consumers are going to draw. And when we look at the nature of these effects, they can be pretty large and not necessarily what we'd like to see all the time. So there are many beneficial effects of nutrition disclosures and communications, but there are a variety of different types of factors that are going to impact effectiveness overall. And all of these things, as Craig talked about, as well as all of the previous speakers, leads into lots of things that are going to have a big impact on consumption behavior. So there's lots of opportunity for future research. It's a very, very dynamic field, and it's very complicated. Okay, thank you.